you have two safety buttons here on that table. One, which is used when the patient is supine, facing up, and he can hold it in his hands. Otherwise, we let it stay right here. And this one is when the patient is prone, facing down. You press it to stop everything, press down, and to release, twist it. Press down, twist it. Press down, twist it. Every part of that table can be moved with only one finger. So unlock the port and you can move it with one finger. Lateral flexion of the headpiece, same thing, one finger touch only. When treating a patient supine, you want to have the hand rest up so the patient can relax. And for that, you're going to just press on the bottom of the hand rest and gently raise it up. And you do that on both sides. Okay, the headpiece can go up and down. The button down is locked. Up, we can bring it up. Lock it again. The patient can use those handles in decompression technique, and you can set up the distance of the handle from the table to adapt it to the patient's length, arm length. So you unlock this segment, and one finger pull it out, lock it, then we have it strong. You have a magnetic paper roll here, so you open that up, pull your paper, drop it, it's a magnet, and here you cut down your paper, extremely easy. You also have a flexion of the table. Take the handle, press it, move it down, or move it up. The density of the foam make it less absorbing. Anti-slippery, make it more secure to the patient. This is a pelvic brace, the section that will go on the patient's pelvis. You have an L-shaped metal part, and you recognize the pelvic section by the fact that it can be stretched because people are different lengths. So I'm going to go just right here and hook it up, and the black part will go on the top, and the patient will lay on his back or on his stomach on that section. So this is a thoracic section, the one that will go on the upper part of the thorax of the patient. And this too has an L-shaped bracket on it, and you will place the L-shaped bracket just under a plate that you have at the section right here. And you will lay down flat. For the patient, he will be able to lay down either prone or supine, and the traction will happen between those two segments. As the patient is supine, in traction, axial traction or flexion distraction, we're going to give her that, and she will be able to press on that button and turn off the table. So can you hold that on? And basically it will stop the table. So we have this function, and the other function is going to be under the table, the red button on the right side. So you're going to find here on the right side a red button that you will press down if you have any type of pain as we perform that. So I'm going to lower that for you. Press down, stops. Twist it, open again. You have a self-adjusting auto lock. If you cannot lock because the bracket just hit the table, you're going to just pull it, bring it down, and then you lock it. So pull it, move it away, and then you can lock it. Open it up again. Very, very smooth mechanism. One finger will push down the foot piece. Excellent engineering. The ankle straps are thick, very, very comfortable to the patient. They can hang down, or you can basically wrap them around the table, but when you don't use them. But how it works, very easy. Once you have the patient on, his ankle will go in it. You wrap it up this way, and you put the strap on it, and it holds the patient down. So it will be either for a treatment prone or for a treatment supine, but you can have a traction applied directly on the ankle and affecting the hip. There is a high variation in the patient's sizes, especially in the States. You can have somebody extremely thin and somebody much, much bigger. So a table, a thoracic port like that fits me. If we have somebody bigger, we're going to need something much longer that will become really inconvenient on a thinner person. So you have with your table those extensions that works well, and basically you place them on it, and just like that, and suddenly this becomes extremely big and will fit pretty much everybody. So those extensions comes with your package, and they allow you to treat a thin patient comfortably and a really, really big patient also comfortably. Okay, with this table comes a part which is quite interesting. It's basically a smaller belt in width, and in it you have, and I'm going to show you here, you have a rubber ring that will go directly on the spinous of the lumbar, and it will press it down. So it's interesting to use for retrolisthesis of the lumbar, and very often in some case where you have a stenosing from a retrolisthesis in the lumbar. So how do you apply it? You apply it usually mostly with a flexion type of motion of that table. So you're going to make sure initially that this screw is completely up, okay, to allow you to press then on the spine. When you have done that, you're going to hook up on each side, and then you're going to, maintaining this straight, going to push down the button, tighten it up on both sides. Good. When it's firmly tight, you're going to increase the tension at that level, so it has a nice pressure on the lumbar, a smooth pressure on the lumbar, and there is not much gliding to go with it. And it's quite effective. You have to be careful and monitor the patient at the beginning of the session. And we go. How does it feel? Good. So we have attached him here. We have put an attachment on the ankle, and basically here we have not put any actual traction, but we can put a bit of actual traction initially and then bring the flexion. So very often what we will do, we put the traction to tense the body, then we set up our thing, and finally we go in flexion. Lateral flexion is used with segmental extension, segmental lateralization, axial traction, straight flexion, and as you can see, one finger is enough to move the table with the patient on. So it's very, very smooth type of articulated table.
To jest wyrób medyczny. Używaj go zgodnie z instrukcją używania lub etykietą.